not a lot surprises me anymore, but his ulcerations were profound. A skin finding may actually be the sign of internal pathology. I'm here to reveal it as your SkinTellAgent. I met Bert on an evening after work a couple of years ago, after he had been under the management of another doctor for several months for wounds that were not only not getting better, but were progressively getting worse.
Actually came out of an ER visit, and I think, Sharon, it must have been our frustration with this wound wouldn't heal. It was not a new wound, and it was because for months we'd tried every different household drugstore remedy, and it would continue to fester. It had started as a minor scratch when I think I fell on my mountain bike. He was very puzzled. It became a real mystery that he seemed consumed with it. He wanted to find out why this wouldn't heal. He would try one thing, and then we'd come back to the next week and he'd shake his head and say, "I don't understand why that didn't work."
Unbelievably painful. I was actually quite surprised to see what I saw when I got there, and not a lot surprises me anymore, but his ulcerations were profound. They were deep, they were broad, they were actively enlarging. He had exposed muscle and tendon and had been dealing with them for some time.
Yeah, I would spend 2 to 3 hours in the hyperbaric chamber every day, right? 5 days a week for 60 treatments. And it didn't stop the growth of the wounds.
Bert has an underlying diagnosis of Parkinson's disease. So he struggles with some movement disorder to begin with, and essentially these wounds had now made him unable to walk. From the struggle of the movement disorder coupled with the overwhelmingly large and deep wounds, ulcers, open areas on his skin that had progressed down to the muscle and tendon, he was in so much pain that he was no longer able to walk.
I remember at the time when you were getting involved, he looked at me and he said, "I'm concerned about your legs." And I knew what he meant.
Yeah. The disease was pyoderma gangrenosum, which is an autoimmune disease that causes inflammation, but subsequent to the type of inflammation, it's frank tissue destruction. So it destroys the tissue structure of the skin opens up, and it continues to sort of eat away at the skin. What struck me when I met you was that we, frankly, were behind the 8 ball, right? And you probably at that point were realizing that as well, and you, Sharon, I'm sure. And pyoderma gangrenosum is one of those diseases that if you're not, on it in those first several days, hours to days to weeks, it rips through you. It rips through this tissue and is so powerfully destructive that you are exposing tendon and muscle and nearly bone.
Dr. Ackerman came to see Bert when he was in the hospital, and one of the things that she felt is the pathology report was not thorough enough, and they needed to look for different things, and so that really helped, and we knew that she was leaving no stone unturned to be sure we got the right treatment. So Bert was admitted that day. He ended up staying there more than a month. Bert was in the hospital over 40 days.
So I was looking for an agent that we could give him through his IV that was very potent and could knock out that inflammation specifically. And we were getting a denial from the health plan. And I basically took the phone at one point from the nurse when they had finally gotten me to the right party. And I said, if you want this man to lose both of his legs during his hospitalization, you will continue to deny this medication. And if you think that he deserves an opportunity to ever walk again, you'll let me have an opportunity to use this medication. And they obliged, and we did. And that was the very beginning of Bert turning the corner. I mean, he was on that medication and some fairly high-dose steroids, and ultimately did require, once we got the inflammation under control, once we could stop that sort of decombustion or wrecking ball that was going on inside the skin, we could then get him into some surgical grafting procedures and ways to cover the wounds, so it was no longer active and progressing.
I had great confidence in the doctors that were the specialists, including you, Dr. Ackerman, that were working to try to treat me effectively, to find the most effective treatment. And so I felt comfortable in that. I felt like I could just relax and let you do your work and hope that it would work.
Bert and his wife, Sharon, have been completely consumed, if you will, by the management of this disease and what it's done to his debility. His underlying Parkinson's, again, never goes away. So the ability for him to move physically and to continue physical therapy and all of those things that are good for Parkinson patients have been grossly limited over the past couple years.
Back in the summer, he said, this is going to take a while. And Bert and I thought, like, from June to October, we thought we'd be done. And but we actually have talked about it. We think it's good we didn't know, because I think that would have been overwhelming to us.
We're usually in 5 or 6.
5 or 6? Yeah. So we're going to make it right into here. I should just right there.
I think we'll take him in backwards.
Yeah. Talk to me about what's been happening with your wound care lately.
Lately, we've been able to make some progress with closing the last couple of wounds. And it's slow.
You said closing
the
last couple of wounds?
Yeah.
Amazing.
Yeah.
Okay.
So much of the progress has been 2 steps forward, 1 step back. And so much of this has been detective work on your part, Dr. Gottlieb, taking the primary lead roles in trying to figure out what was causing the wounds to not heal or to get worse.
And some of this is incredibly experiential for us, because navigating the course of pyoderma gangrenosum in any given patient is really its own science project. I mean, not any one patient necessarily behaves like the next, and navigating it with, what debility you struggle with, not just from the ulcers, but what it does to your ability to continue PT and rehab for your Parkinson's.
Yeah,
I mean, that's a
really has complicated it.
Yes. Not hurting you?
No.
Is it tugging at all?
It's okay.
Oh, wow. And that was the one that was tunneled. Oh my gosh, that's great.
And he went months and months not being able to put weight on either.
Right, exactly. I mean,
fortunately, he had a strong arms.
Yes, he did. And a strong wife.
Yeah.
No, this looks great. And when we bandage this back up and put your braces back on, these are legs that can actually ambulate. These are legs that can walk. Being a part of the journey, and sometimes just even witnessing how partnerships help to move progress, is really remarkable. We should be not too blind and too quick moving to miss that, because it's a beautiful thing. And it was unbelievable when Bert was just recently here that we were able to actually walk down the hallway together. I've never seen the man walk. Cheers to them, and for perseverance, and for never giving up, and for recognizing that through thick and thin, there was an outcome that could be reached that was going to get Bert to a better place. And they're there. They're not done, but they're definitely in a much better place. And Bert is absolutely, he's been able to travel. He's been able to do some things that I know he wanted to do that were important to him.
I may not be able to do the Mount Humphreys Trail again. But I'll be happy to walk in the park again.